Hello. Today, I organized the contents to supplement the last video. In the last video, I talked about starting ultrasound with the sublingual gland when doing neck US, but it may not be easy to find a sublingual gland by ultrasound. So, I'll show you the actual location of the probe to find it by ultrasound. To find a sublingual gland on US, the probe should be directed upward just below the chin. This is where you can see the hyoid bone. And here you can find the cricoid cartilage. In my experience, many residents could not find the sublingual gland. Instead, they left tongue base image on ultrasound. After you find tongue base on ultrasound, you can find the sublingual gland if you turn the ultrasound probe towards the patient's head. I'm going to show you a video. This is a US image of tongue base. If you proceed with the ultrasound probe in the direction of the patient's head, you can find the sublingual gland. This is the digastric muscle and the mylohyoid muscle. It is important to initiate thyroid ultrasound at the location of the sublingual gland. The thyroid gland develops at the base of the tongue and then gradually moves down the neck. I will show you the case. A 30-year-old female patient has long been on medication for hypothyroidism. On CT, you can see the mandible bone and the sublingual gland. We can see the ectopic thyroid on submental area on CT and thyroid scan. No uptake is seen in the thyroid area. A 45-year-old woman had an ultrasound because she felt a lump under her chin. On neck US, you can see a hypoechogenic mass with good margin at her submental area. But we could not find her thyroid gland in its normal location. On neck CT, you can see an ectopic thyroid tissue at submental area. This is a 39-year-old female patient. She had a 1 cm suspicious nodule in left thyroid, and a 5 mm suspicious nodule in right thyroid. The left nodule was bigger than the right, but lymph node metastasis was on the right side. This is the right common carotid artery, and internal jugular vein is collapsed. She underwent total thyroidectomy and right lateral neck lymph node dissection. Finally, there were bilateral thyroid cancers and right lateral neck lymph node metastasis. After that, radioiodine therapy was performed. After treatment, serum thyroglobulin was increased. In meticulous US exam, mass was found around the hyoid bone. You can see the enhancing mass around the hyoid bone on CT. After removal of the mass, serum thyroglobulin was normalized. You can commonly see the thyroglossal duct cyst near the hyoid bone. About 30% of patients with a thyroglossal duct cyst have a thyroid tissue. So both benign or malignant nodule can occur. This case is a benign nodule arising from a thyroglossal duct cyst. Thyroid tissue can be placed even in the upper area of the isthmus. This is a pyramidal lobe. On thyroid US, especially preoperative staging US, all thyroid tissues should be detected and recorded. Cancer can develop in thyroid tissue wherever it is located. This is a 59-year-old female patient. Right lateral lymph node metastasis was diagnosed at an outside clinic and was admitted to our hospital for surgery. But primary thyroid cancer was not found at the outside clinic. On preoperative staging US, I could not find a primary thyroid cancer where it should be. The primary thyroid cancer was found near the thyroid cartilage. The cancer originated from the pyramidal lobe. You can see the mass on CT. This is a mass and this is a thyroid cartilage. A 69-year-old male patient had hoarseness for a long time and had a neck ultrasound at an outside clinic. A small calcified nodule was found and aspirated at the nodule. The cytologic result was non-diagnostic. He was referred for further evaluation of his nodule. On thyroid US, I found a small nodule at his right thyroid gland. As I told you in the last video, it is necessary to see all areas from the sublingual gland to the sternum on thyroid US. On US, the lateral part of the right thyroid cartilage was broken. And you can see the mass. This mass can cause his hoarseness. The mass was hypopharyngeal cancer. A small thyroid nodule was not a big problem for this patient. I will show you a video from sublingual gland to thyroid cartilage. This is a sublingual gland. This is a tongue base. This is a hyoid bone. You can see an inverted V-shaped thyroid cartilage. Normal cartilage has this continuous echogenic line. You can see the difference with this broken cartilage. This is a cricoid cartilage. Both thyroid and cricoid cartilages can be mistaken for thyroid nodules. Especially, an inferior horn and nearby muscles of thyroid cartilage can be mistaken for pseudolesion. The cricoid cartilage can be mistaken for a mass only in the longitudinal plane. Ossification of cartilages can vary from age and sex, so it is easily mistaken for calcification. Sometimes, inferior constrictor muscle can be mistaken for a thyroid nodule. On US, the muscle surrounds the thyroid cartilage. This patient was referred for a thyroid nodule on US. On transverse US, the marked area is an inferior horn of a thyroid cartilage. On longitudinal US, the marked area is a cricoid cartilage. This is the other case. The marked area from outside clinic was thyroid cartilage. On transverse US, thyroid cartilage is seen as an inverted V-shape and cricoid cartilage is seen as an inverted U-shape. It's not hard to find normal structures on transverse US. But there may be difficulty in distinguishing nodules on longitudinal US scans. For better understanding, I will show you the video. This is a thyroid cartilage on transverse US. I will turn the US probe clockwise. You can find the normal thyroid cartilage on longitudinal US. Because of the nearby muscles, it may be mistaken for a mass. If you move the probe more medial, you can see the cricoid cartilage. This time, let's just focus on the cricoid cartilage. This is a cricoid cartilage on transverse US. I will turn the US probe clockwise. You can find the normal cricoid cartilage on longitudinal US, which looks like a mass. Each person has a different ossification of cricoid cartilage, so the calcification looks different. When performing the thyroid US, you have to examine the lowest part of the neck that can be seen by US. The patient had a tiny suspicious thyroid nodule on right isthmus. Cystic metastasis was found just above the sternum. Thank you.